6 people have died in a bus accident in Mojaji's Kloof, Limpopo. The bus was on its way to an ANC event. So for more on this, I'm joined on the line now by Limpopo Health MEC, Popi Ramatuba. MEC, thanks a lot for joining us this afternoon. I do understand that Home Affairs Minister, Dr. Adam Motsoaledi, as well as yourself, were on the scene, given the fact that you are both trained in medicine. Let's talk a little bit about the state of the injured passengers.
Afternoon and afternoon to all your viewers. It's indeed a sad day for us as the people of Limpopo. The accident happened around the road towards Sekgopo. It is not on the Mojaji's Kloof. We can indicate is that on the scene we have been able to certify 6 to have died on the scene, and then we had around 9 patients whom we classified as P1, meaning priority 1. They are severely injured. You talk of your head injuries and also multiple fractures that those 9 patients sustain. We've been able to transfer them, all of them, to Pietersburg and Mankweng Hospital, which are our biggest hospitals in the province. And we had around 14 patients whom we could classify or triage them as priority 2 and priority 3, meaning they were the P2 who were injured and also the P3 who were slightly injured. All those 14, we are with them now at Gapane Hospital, where we have joined the medical team in Gapane can be able to assist and admit those who require admission, because there are those who will not necessarily require admission. We'll just treat them for soft tissue injury. And the rest of the passengers whom we have not been able to see are those that we classify as heavy suffered just shock, because of course an accident, especially a major one which takes lives, will therefore make you who as a passenger to suffer from a shock. Those we are busy with our social workers and our psychologists to provide a debriefing so that before we can discharge and take them to their different homes, we will be able to be rest assured that emotionally and psychologically they will be able to be sound. So those ones I have not been able to get the total number so that we can reconcile with the number of passengers on the bus, we are working with our sister department, the MEC for Transport is here with me, so that we can be able to assist each other in dealing with this serious crisis that faced us at the moment.
Well, it's a very serious crisis, MEC. Let's talk a little bit about establishing the cause of the crash in the first place.
It is very difficult for me where I am sitting, because most of the time from us as medics, we will usually get the cause of a crash from the driver. But unfortunately, we lost the driver on the accident scene. And when I'm with patients who were passengers, it is very difficult for me. It doesn't come to my mind to start to ask them how did the accident happen, because on its own you are asking them to relive that traumatic experience that they found themselves in. So hence my colleague is here with the police, with the traffic officer, who of course they will be able to say, after we've done the debriefing on the other passengers who have survived, they will be able to take proper statements and proper history. And also at the same time, we left the police on the scene, who have been doing their work in terms of looking at what could have caused the bus to find itself having rolled. We don't, at the moment, we don't know what really has transpired. What was of urgent for me and the minister and all the other political leaders who were on the scene was to make sure that those who are severely injured are able to be firstly given the first treatment, and those who are also injured followed suit as we do triage our patients on the accident scene, and also to make sure that those who are deceased, we've been able now transported them to our mortuary here after resuscitating and completing attending to the emergency. We'll be able to sit down. We are waiting for some of the family members to start the identification process, so that once that is done, we will be able to inform the next of kin and take it from there. But I'm quite sure that as government, because we've been also requested by the Premier to be here up until every a single person would have been identified and attended to. We will be able, through the Department of Transport, be able to give the public exactly what could have transpired to have caused the accident.
MEC, we're going to leave it there for this afternoon, but thanks a lot for joining us and shedding some light in terms of the state, number one, the condition of those who were injured in that bus accident, but also looking now at how do you establish the cause, what happened that led to the death, unfortunately, of 6 people and the injury of dozens more.